Hello friends, welcome to my YouTube channel. My name is eberechiayogu. Welcome to eberechiayogu Health Tune, a channel that teaches you about infectious agents and the diseases they cause. Thank you for subscribing to my YouTube channel. Thank you for watching my videos. It means a lot to me. And if you have not subscribed, please, if you come across my video, watch it and subscribe. You are making me to grow, and most importantly, you are learning about your health. Today I want to talk about urinary tract infection. What is urinary tract infection? Firstly, what is urinary tract? Urinary tract is a system in our body by which urine is being produced and passes through the tract to the external environment. This urinary tract involves the kidney. The kidney is where the urine is being produced. Then the ureter is a tube that connects the kidney to the bladder. After the production of the urine passes through this ureter into the bladder, where it is being stored for a while before passing through the urethra. Urethra is a tube that passes through our vagina, and that is where our vagina or our penis, and that is where the produced urine pass through to the external environment. So, what causes this urinary tract? This urinary tract is caused by a bacterium majorly caused by a bacterium called E. coli, eberechiayogu. This E. coli is being created by God into our intestine, and they are living there as a normal flora. They are not infecting us, they are not harming us, they are just there. So sometimes this E. coli will leave the intestine, come to the rectum. Rectum is the end of the intestine, and from the rectum it will now enter into our anus. And if anything carries this into our vagina or our penis, it will now enter into the urethra. From the urethra, the E. coli starts traveling through the urinary tract, causing us different degrees of infection. Because this urinary tract is divided into two. We have the upper urinary tract and we have the lower urinary tract. The upper urinary tract is the kidney and the ureter, while the lower urinary tract is the bladder and the urethra. So, when this infection enters the lower urinary tract, the symptoms of this infection may be mild. But when it now infects the upper urinary tract, it may be severe. So, what are the symptoms of this infection? The general symptom of this infection is frequent, and the most common symptom is frequent urination. You will be visiting the toilet every now and then, and you will be having a very strong urge to urinate, even though you know you are having an empty bladder. Then when you get to the toilet, you will either pass a small amount of urine, or you will not even be able to urinate at all. But before you leave the toilet, you have already started having an urge to urinate, and a pressure in the pelvis, as if to say you want to pass something out by force. So these are the most common symptoms. And again, the burning sensation when you are urinating, either your vagina or your penis will be paining you, will be burning you, and like there is spices inside of you. You just be having a pepperish urination, or it is called burning sensation. So these are the most common symptoms, especially when it is still at the lower urinary tract. This infection may get to the upper urinary tract, and the symptom may now include headache, fever, chills, nausea. Then there may be blood in the urine. As you are passing urine, you will see blood in your urine, or the blood. You may not see the blood with your naked eyes, but when you go for tests, microscopy will now show that you are having blood in your urine. Okay, in men, they may be having cloudy urine. It may happen to women too. Cloudy urine that is having foul smell. So these are the most common ones. There are other symptoms of maybe not be able to hold urine or other symptoms that you may experience. So but this one I mentioned is the most common one that you will see. So how does this infection occur? So what are the predisposing factors? What causes it? How do we get it? Number one is sexual intercourse, sexual activities. After sexual activities, one's supposed to go to the bathroom, take your bath, clean up very well before having another round, or before doing another thing. You have to clean up all the secretion that comes from your body. This is because the secretion in our body, what we secrete during sexual activities, is a good medium for the growth of microorganisms. And if you did not clean up very well, both this E. coli and other organisms may start growing on your body after intercourse. So like this, we can get this E. coli and we can be affected with urinary tract infection. So another one is that the normal flora, this normal flora is the organism that God put in some places in our body, some strategic places that checkmate the activities of external pathogens that may come into our body. Inside our vagina, for women, we are created with bacteria inside our vagina that checkmate the activities of other bacteria or fungi that may come into our vagina. So this normal flora, it checkmates the activities of other external organisms. But as we are aging, we may be losing this bacteria that used to checkmate them. So like that, there will be opportunity for E. coli to grow whenever it gets into our body. Another one is, again, for women, the anatomical side, the way God created us, that our urinary tract, this urinary tract that I mentioned before, is shorter than men's own, and because of that, our urethra is closer to the anus, and the E. coli can simply get into our vagina because the anus and the vagina are very, very close. So for that reason, women are more prone to this infection than men. Then another one is that some people, after using the toilet, if you are still using wipes to clean up after the toilet, some women used to wipe from back to the front, using the toilet to wipe from the back to the front, and by doing so, you can carry out E. coli from the anus into your vagina, and it will enter into your urethra. From there, the infection may have started. So you have to wipe from front to back, or better still, use water to clean up after using the toilet. This is another one. So how do we prevent it? We prevent it by running away, by avoiding all these predisposing factors that I mentioned. Don't wipe from the back to the front. After the sexual activities, make sure you clean up very well, because this infection is not classified as sexually transmitted disease, but sexual activities cause it. The treatment, there is a treatment for this infection. The treatment is antibiotics. There are so many antibiotics that are meant for this E. coli, for this UTI. If you are having any of these symptoms that I mentioned, go to the hospital, get yourself diagnosed, so that the doctor will know which antibiotics is best for you. The one that is working for Mr. A may not be working for Mr. B. So go there, the doctor will diagnose you, tell you the prescribe antibiotics for you, so that you use. Don't treat yourself by yourself, because you are not a doctor. And again, it's not because this infection has a cure. You will now keep on doing anyhow, exposing yourselves to bacteria. These antibiotics, there is a way you will use antibiotics and it will grow resistance to your body. The antibiotics that are used to cure a particular infection in your body will stop curing that infection. Then you will be saying, this is what I've been using now, why is it not working for me? And maybe it is somebody that is doing me, or maybe it's this person or that person, but you are the one that is doing yourself because you have abused the antibiotics. So keep yourself away from infection. Then prevention is better than cure. Thank you for watching my video this week. Another interesting topic is coming your way next Friday. Stay tuned. Don't touch the dial. Learn about your health. Thank you.